Imagine this for a second, a weight loss medication that works like Ozempic or Wegovy, but instead of injection, it's just a pill. So no needles, no weekly shots, just something you take by mouth. Sounds almost too good to be true, right? People living with obesity need treatment options that meet them where they are. And for many, a once daily pill that can be taken without any food or water restrictions can offer them greater flexibility in how they approach their treatment. Well, this is now real. A new medication called Orforglipron, brand name Foundayo, was just FDA approved. Hi, I'm Dr. Bazgha Khalid, and I'm a board certified internal medicine and obesity medicine specialist. And I prescribe GLP-1 GIP medications like Zepbound and Wegovy in my clinical practice all the time. But one of the questions I do get asked very frequently is there a pill version of these medications? And now the pill version of weight loss injections is becoming a reality. So, what is Orforglipron, brand name Foundayo? Orforglipron is a GLP-1 receptor agonist, same family as Ozempic and Wegovy, but here's the key difference. Orforglipron or Foundayo is a small molecule pill and not a peptide injection. Now, why does that matter? Most GLP-1 medications get destroyed in our stomach due to stomach acid. That's why they had to be injections. However, Orforglipron or Foundayo survives digestion and gets absorbed as a pill. That's a big deal. Foundayo mimics a natural hormone called GLP-1 or glucagon-like peptide 1. And that hormone does three really important things in our body. Number one, GLP-1 slows down your stomach. It slows digestion, food stays in your stomach longer, and this makes you feel full longer. So you naturally eat less without forcing it. Number two, GLP-1 reduces hunger signals in the brain. Now, this is the part most of my patients love about GLP-1 medications the most. This means less food noise, fewer cravings, and less constant thinking about food. Number three, GLP-1 improves blood sugar control. It helps your body use insulin better, which also helps reduce fat storage. So while on these medications, you're not fighting your body anymore, your biology is actually helping you with the use of this medicine. All right, let's talk about clinical trials and results because that's what everyone wants to know. Foundayo is supported by the rigorous ATTAIN clinical trial program, and it was proven to help people lose weight and keep it off. In the ATTAIN 1 trial, the individuals taking the highest doses of Foundayo and who stayed on treatment for 72 weeks lost an average of 27.3 pounds, which is 12.4% of their body weight, compared to 2.2 pounds, which is about 0.9% of body weight in the placebo group. Participants taking Foundayo, regardless of whether they completed the trial or not, lost an average of 25 pounds or 11.1% of body weight compared to 5.3 pounds or 2.1% with placebo. Now, let me put that into perspective. If someone weighs 200 pounds, that's about 22 pounds of weight loss. But that doesn't mean everyone will lose that much weight. Some people may lose more weight, some people may lose less. It's all about biology and how our body responds to these medications. And these medications only work if it's part of a bigger plan with the right nutrition and exercise. In the ATTAIN trial, Foundayo also led to reduction in many markers of cardiovascular risk, including waist circumference, non-HDL cholesterol, triglycerides, and systolic blood pressure across all doses. This means that these new weight loss medications not only help with weight loss, but they also help improve overall metabolic health. So who is Foundayo actually for? Foundayo is FDA approved for people with BMI of 30 or more or BMI 27 or more with conditions like diabetes, high blood pressure, high cholesterol, or other weight-related chronic health conditions. So this is not just a quick fix or a cosmetic weight loss pill. This is a medical treatment for obesity. In addition to chronic weight management, Orforglipron or Foundayo is being studied for potential treatment for type 2 diabetes, obstructive sleep apnea, osteoarthritis, knee pain, hypertension or high blood pressure, peripheral arterial disease, and stress urinary incontinence. Now, the question usually comes, do you feel like medication should be used earlier in weight loss management or only as a last resort? I'm curious what you think. Let me know in the comments. Now, let's compare this new weight loss pill to something like Wegovy or Zepbound injection. Pros of the Foundayo pill are, well, it's a pill, no needles or injections needed. And therefore, it is easier for needle-averse patients and potentially easier to scale globally, as it's much easier to make a pill than to fill hundreds and thousands of injection syringes. While the cons of Foundayo pill are daily dosing, you have to take the pill every day. It's not a weekly injection, and some people may prefer that convenience of weekly injection. And long-term adherence might be harder for some people. Some people actually prefer a weekly injection because they don't have to think about it every day. So this isn't automatically better, it's just as another option. How about comparison of Foundayo pill versus Wegovy pill, which was also recently FDA approved? I'll post the link of that video in the description. So both the Wegovy pill and Foundayo pill work in a very similar way. They're both GLP-1 medications, meaning they reduce hunger, slow down digestion, and help with blood sugar control. But the big difference is how they're built and how you take them. Wegovy pills are peptide-based, so they have to be taken on an empty stomach with strict timing and water rules. Whereas Foundayo is a small molecule, so it's much more flexible. You can take it anytime, with or without food. In terms of weight loss, both are effective, with Wegovy pills showing slightly higher average weight loss in some studies of 12 to 15%, while 11 to 12% for Foundayo. Side effect profile is very similar. So at a high level, they're similar in what they do, but different in convenience. And for many patients, that convenience could actually be the deciding factor. Now the big question, what is the cost for Foundayo? Based on Eli Lilly website, Lilly is committed to making Foundayo accessible and affordable. Eligible patients with commercial insurance may pay as little as $25 per month with the Foundayo saving card. Individual options for self-pay can access Foundayo starting at $149 per month for the lowest dose. Additionally, eligible Medicare Part D individuals may be able to get Foundayo for $50 per month beginning as soon as July 1st, 2026. My hope really is, since Foundayo is a pill, it will be easier to manufacture and hopefully available globally. And hopefully due to more competition with rivals like Wegovy pill and other newer weight loss medications in the pipeline, the cost of these medications will come down. Because I truly believe these medications need to be accessible and affordable for all who will benefit from these. How about side effects of Foundayo? Side effects are very similar to other GLP-1 medications. Nausea, vomiting, diarrhea, constipation, indigestion, stomach pain, headaches, swollen belly, feeling tired, belching, heartburn, gas, hair loss. Usually these side effects are mild to moderate and often improve over time. But again, not everyone may be a good candidate and may tolerate these medications. And like other weight loss medications, Foundayo needs proper medical supervision and close monitoring. Use of Foundayo with other GLP-1 receptor agonist medications is not recommended. Foundayo has same FDA black box warning like other GLP-1 medications, as it may cause tumors in the thyroid, including thyroid cancer. Foundayo is contraindicated if you have personal or family history of medullary thyroid cancer, if you have personal or family history of multiple endocrine neoplasia syndrome type 2, this is the cluster of tumors in thyroid, parathyroid, and adrenal glands, or if you have a serious allergic reaction to Orforglipron or any of the ingredients in Foundayo. Now let's talk about some practicality of any weight loss medicine, whether it's old or new. Weight loss medications, whether pill or injection, is not a magic treatment, even though it sounds like one, because if lifestyle doesn't change on these medications, then results are often limited, and if you stop these medications without an exit plan, weight can come back again. Weight loss medications work best when combined with protein intake, strength training, and better sleep. So think of these medications as a tool, not a solution by itself. So if you are wondering, should I consider Foundayo? Here's some questions for you. Have you struggled with weight despite trying? Is your weight affecting your health? Are you ready to combine medications with lifestyle? If your answer is yes, then please discuss your treatment options with your doctor, as these new medications might be a very powerful option. We are entering a completely new era in weight loss, where biology is being treated and not just blamed. And medications like Foundayo are changing how we think about obesity, not as a failure of willpower, but something that we can actually treat properly, medically, and effectively. What makes Foundayo approval significant is that it represents a shift. For the first time, we now have a true oral GLP-1 option for chronic weight management that doesn't rely on peptide injection technology and that could fundamentally change how we treat obesity globally, not just in specialty clinics, but in primary care and even broader settings. So I want to ask you, would you consider a weight loss pill like Foundayo, or do you still feel hesitant? Drop your thoughts below. I read all of them. And make sure you're subscribed so that you don't miss any of the upcoming videos. Stay happy, healthy, and well, and I'll see you in the next one. Bye for now.